Home care for Alzheimer's patients. Where do you even start? If you or a loved one has been diagnosed with Alzheimer's and dementia, there may become a time when life at home becomes too much of a health and safety risk. However, the seniors do not want to move from their home. They might have lived there for 20 or 30 years with a spouse, and they don't want to make their transition to a memory care unit or to a facility that they're going to be spending time with more Alzheimer's and dementia patients. How do you even recognize quality care? When you sit down in front of the computer or you open up the phone book, all of the choices are overwhelming. You could find tons. How do you know that one facility or one provider is better than another? The quality of care is difficult to measure if you don't deal with providers on a daily basis. In order to solve the mystery of what quality care for Alzheimer's and dementia patients should look like, a family has to educate themselves on the whole picture and understand what the needs of their family member or their loved one truly are. It's important to find a provider that is proactive rather than reactionary. Finding a care provider that can help anticipate safety and environmental needs of an Alzheimer's and dementia patient is paramount. The current bathroom that your dad has might work for him right now, but as he becomes older and more advanced in his Alzheimer's needs, he might need a different bathroom, a bathroom modification. What about, can your mom dial 911 in the event of a fire? I had a client one time who told me, I asked her whether or not she could notify the authorities of an emergency, and she said, yes, I'd call 911. And I asked her to show me how she would call 911. And she couldn't put the steps together to make the phone call to call the authorities in the event of emergency. And that's just something that the family hadn't even thought about asking her how she would do that. They just knew that she could, or they thought that she could, because she knew to call 911. What about nutrition and meal planning? Is the patient going to the grocery store and picking up snacks because that's what tastes good, and instead of eating good nutritious meals that will help maintain their health? It's another concern that our Alzheimer's and dementia patients have. Alzheimer's and dementia patients and their families need a trusted source of information, as well as a provider that's going to be at their side for the long haul. When I meet with an Alzheimer's family and an Alzheimer's patient for the first time, I tell them a lot of times this is like putting together a big jigsaw puzzle. You're going to get a couple of pieces of your puzzle from your financial advisor. They're going to be able to tell you what you can afford to do and how you can plan financially. You might also get a couple of pieces of the puzzle from your physician. He might tell you what to expect and have your medications and be prepared that way. You might get some more of the puzzle pieces from your local church, because those are the people that you've seen every Sunday and every Wednesday. You might also get pieces of the puzzle from family and friends. We have to sit down and put those puzzle pieces together to get a good idea of the care needs of that particular patient. A great care provider will assist families in getting all of those pieces together and provide a safe and comfortable environment for their client. Now, safety and comfort and being comfortable in your home environment is not just a safe environment. It's just not making sure mom can stay at home, but it's also the nuances of what's going on in the home. Maybe every night at 5 o'clock, mom and dad sat down and they ate dinner to Wheel of Fortune and Pat Sajak. And that was their norm for years. Well, maybe mom or dad has passed on and we have another spouse in the home, and nobody understands why they're not eating it, because we're serving dinner at 7 o'clock at night. We have to remember what was important to them and provide those things that will trigger them to eat. It's those little things, those little details that have to be remembered. Those details can be learned only by taking a very comprehensive history and getting to know that client and their past habits and preferences. Everybody's puzzle is unique. Like I said earlier, you're going to get your puzzle pieces from a lot of different sources, and everybody's puzzle is different. Everybody's going to get their puzzle pieces from different areas. It's necessary to go the extra mile to learn as much as possible about the Alzheimer and dementia client and provide them with the best possible care. By taking that extra time, you're going to stave off hospitalizations, unnecessary doctor visits, and keep them safe in their home environment for as long as you can. By diligent observation, habits, and physical behavior, unnecessary pain and discomfort can be avoided. These extra steps and a few other factors can contribute to exceptional care for the Alzheimer's and dementia patient.